far as substance use within the county and with the encampments we go to, we're starting to see a lot of fentanyl, as you know, that's become very prolific, across the country in the last few years. Also, methamphetamine use and marijuana use, and then also, long-term tobacco use, whether it's cigarettes, and also alcohol use. The most disheartening one is definitely with the fentanyl, just with so many, with overdoses occurring, and then also, in the work that we've done, we've come across, clients that know loved ones or know friends or other folks that were experiencing homelessness that have lost their lives, unfortunately, to fentanyl use. The trend in terms of the drug use within the last year, it has definitely leaned more towards fentanyl. The most really hard thing is that it's, as you may know, it is being laced with other substances. So a lot of folks that we talk to that whether use methamphetamine or marijuana, they've reported that, a lot of the stuff that they get, or people they get it from, or people that, other people they know that are using those substances, they find it laced with fentanyl. Fentanyl has become like one of those things where most people just want to try to stay away from. Like, we've talked to folks that are long-term meth users or long-term marijuana users, and they're like, I will not touch fentanyl. And then, it's unfortunately sometimes, there's a bad batch that is, distributed. When we go into the homeless encampments, we collaborate, a portion of our team collaborates with the city of Sacramento, and we go in trying to connect folks to various resources. We want to try to bring the most wraparound services that we can. So the city really helps support with, getting folks into shelters, and we support folks trying to get into mental health services and also substance use services. So that usually starts with a, very humanistic approach, just honestly saying, introducing ourselves. Hi, my name is Justin. I work for Sacramento County. Asking them how they're doing, and then from there, once that rapport is starting to be built, telling them what we do, and then also asking them, is there something that they're looking for to help get connected to? Our team really comes from an approach of wanting to knock some of the stigma that is out there about, people start experiencing homelessness because they're using drugs. From what I've seen in my experience working with folks, it's quite the opposite. A lot of folks that are out in these homeless encampments, they lost their job, they lost their housing, and then they turned to substance use as a form to cope with that because there was an avenue that they saw. Also, sometimes it's for safety reasons. Folks that are experiencing domestic violence or running from perpetrators, sometimes they use substances to stay alert and stay awake, just to be able to be vigilant of their perpetrators. So in regards to the stigma of experiencing homelessness, there's definitely this misperception of, individuals are doing that because they're using substances, or they're just doing that because they want to experience homelessness. That's kind of the trend that we've seen, is that a lot of misconceptions are they want to experience homelessness, but when we talk to folks, it's quite the opposite. They want to go into programs, they want to get connected, but there's been so many years of distrust and just figuring out how to navigate that system is really a big piece of it. What I'm seeing within the encampments is definitely a lot of struggle, definitely a disconnection from the larger population, and a lot of, whether that's disconnection from service providers or disconnection from family members or disconnection from loved ones.